Mammograms basically are an anatomic assessment of the breast. It is an X-ray of the breast. And what we're trying to get at is what does the tissue underneath look like? And so when we do a screening mammogram, our recommendation is that women 40 and older consider yearly screening mammography. And this is Mayo's stand on that, or the recommendation that Mayo Clinic has, is to do yearly screening mammography starting at age 40. And what it is when you do a mammogram, the breast is composed of milk glandular tissue. Around that, there's some fibrous tissue, and then there's fatty tissue. And the glandular tissue and fibrous tissue casts a shadow, which is whitish on the breast. Fatty tissue looks black on a mammogram. So when you look at a picture, the tumors also look white. So you're trying to find a white tumor within a lot of white, dense tissue, and that's a challenge in women who have dense breasts. For women who have dense breasts, it is important to understand that there are additional tests. We call it supplemental screening. And these are tests done in addition to mammogram that could help us pick out those potentially small cancers or even invasive cancers. MRI of the breast is very specialized, which means you get an IV injection of gadolinium that's excreted by the kidneys, but it highlights breast tissue very well. The downside of MR is that because it's highly sensitive, it is able to pick up even the smallest cancer. The downside is that false positives are quite high with MR, and it requires a lot of effort in reading and at this time required for all of that, and it's an expensive tool. For a woman with dense breasts, her screening can be done with tomosynthesis. So she doesn't need to have a mammogram and a tomosynthesis. The tomosynthesis is built into your screening mammogram. So when you say you go for mammogram, you do 3D mammogram. So that would be the first thing. For all women at this time, screening is important in terms of ensuring that we are careful about our health. And it is a promising time in that there are newer techniques available to screen for breast cancer, and a promising time also that even if we do get diagnosed with breast cancer, there are many options available to us that will help us long-term in living, healthy, fulfilling lives.